best thing for anybody is to keep their own teeth. There is nothing I can do or anybody can do to replace what God has been giving you in your mouth. So my vision, my priority is just help my patients to keep their own teeth. But in situations where the cavity has been growing too bad and is into the nerve of the tooth, we have an option that is called root canal. And the root canals can be pleasant if you come in to see the dentist right away after you start having pain on the tooth. If we do that, the outcome of the root canal and the success is really, really high. If we wait too long and the infection happens and it spread too much, then having a root canal, sometimes the success rate is not as high. If it's possible and the tooth can be saved, that is my recommendation for most of my patients. Keeping the tooth is better than pull it.